Hello everybody. Welcome to No1doctor channel. Today we will talk about one of the famous doctors. Cuthbert Esquire Dukes, 1890 to 1977. Dukes staging of rectal tumors. The Dukes classification of the staging of carcinomas of the rectum, which was extended to include all large bowel tumors, represented the first major step in a logical classification of tumor spread, a valuable tool in prognosis. In recent years it has been modified to include presence or absence of spread of tumor to the local venous drainage, and today is being replaced by the universal TNM, tumor, node, metastases, classification. Cuthbert Dukes was born in 1890. He qualified in medicine at the University of Edinburgh in 1914, at the outbreak of the First World War, and served throughout the war as a medical officer in the Royal Army Medical Corps attached to the Rifle Brigade. He was decorated with the Order of the British Empire. After the war, he trained as a junior bacteriologist at University College, London. In 1922 he joined St. Mark's Hospital, then in the City Road, London, as its first pathologist. St. Mark's was then perhaps the leading center in the world for rectal diseases, in particular rectal cancers. Dukes proceeded to carry out meticulous pathological studies of the rectal cancers removed by his surgical colleagues by abdominoperineal excision of the rectum. Each tumor he first mounted and then dissected. He correlated the staging of these tumors with a careful clinical follow-up of the patients, and was thus able to correlate staging of the tumor with patient prognosis. Initially, in Dukes' 1930 paper in the British Journal of Surgery, he divided tumors into A, growth confined to the rectal wall, B, penetrating the wall, and C, involving the regional lymph nodes. In his 1935 paper, in the same journal, he further divided lymphatic spread into C1, nodes involved near the primary tumor, and C2, where nodes were involved up to the level of the vascular pedicle, and showed that this refined still further the survival rate or tumor spread correlation. Apart from this important work, Dukes also studied familial polyposis coli, establishing a registry and family follow-up of this condition. He worked on the classification of prostatic and bladder tumors at the Institute of Urology, at St. Peter's Hospital, whose staff he joined in 1929. During the Second World War, Dukes visited large numbers of colostomy patients in their homes. His work did much to establish the Ileostomy Association in this country. In recognition of his contributions to surgery, Dukes was elected an honorary fellow of the Royal College of Surgeons in 1950 and was appointed a Hunterian professor of the college 2 years later. Cuthbert Dukes was a kind, gentle and helpful Quaker with a great interest in the trainee pathologists and surgeons at his hospitals. He died peacefully at home in Wimbledon in 1977. Thanks for watching. Hope to see you again in more next videos. With my best wishes. Dr. 8 Fahmed.